I'm Michael Bloom, chiropractor. Lower back pain, it is poorly managed, sometimes poorly understood, and importantly, it really is impactful. It's impactful to the economy, it's impactful to individuals. Lower back pain, this is in Australia, costs the health system approximately $4.8 billion per year, and is the most common health reason to force middle-aged Australians to retire early. This reduces our gross domestic product by more than $10.5 billion annually and can cause long-term financial hardships for individuals. So it needs to have better management. And what I'm summarising here is a clinical care standard for lower back pain, an Australian clinical care standard, which is very important because it lays down the foundations of the best ways to deal with lower back pain. And often the best ways to deal with lower back pain nowadays were not what was recommended, say 10, 15 or 20 years ago. For example, pain medicines, bed rest and surgery are now accepted as playing a limited role in most patients with lower back pain. So those recommendations of pain medicine, bed rest and surgery were utilised a lot more in times past. So what are the current guidelines? The current guidelines in a list is that statement 1, we need an initial clinical assessment. So the good assessment by a trained practitioner as to what may be the cause of the lower back pain. So that will be a thorough history taking and physical examination. Statement 2 is a psychosocial assessment. So that is, how is the back pain impacting the person? In what ways does it get in the way of them living their normal life? And what concerns do they have about their back pain? Statement 3 is that we should reserve imaging such as MRI, CT and X-ray for suspected serious pathology and not be overly reliant on a report written by a radiologist. Statement 4, patient education and advice. So a person with lower back pain, the more they understand about the mechanism of the pain, the more they understand about their prognosis and the likelihood of healing, then the better the ultimate outcome is likely to be for that person. Statement 5, encourage self-management and physical activity. So where possible, help people manage their own lower back pain through exercises, through strengthening activities, through activities of daily living. As best possible, encourage self-management. So the person takes some ownership for the predicament, not fully places the responsibility on a practitioner or a team of practitioners to help them. Statement 6, physical and or psychological intervention. So that is seeing a person who is experienced in the subject matter of lower back pain and partnering with that person to help you or help the person with lower back pain to navigate their way through physical treatment and intervention and through psychological treatment and intervention where required. Statement 7 is judicious use of pain medicines. So consider opioid analgesics only in carefully selected patients at the lowest dose for the shortest duration time. That's one of the aspects of judicious use of pain medicine. So not being reliant on medicine to mask the pain. And statement 8, review. So regularly review the prognosis and the improvement of the person with lower back pain and refer when necessary. Refer if the person isn't recovering and healing in a way which is expected based on the experience of the team that are around the person suffering. So I hope this makes some sense. It's a little bit of a longer video, but I think it's really important just to touch on lower back pain because it is such a large part of our society and so many people suffering with it. And it is important to know that the latest strategies of dealing with it coming from Australia cover those 8 points as mentioned. If you do want any more information, please reach out. If you want to consult someone who's used to seeing lower back pain more than he would like, also reach out. Cheers, have a great day.